Go.
Hello, my name is Creighton. My student identification number is 62176 and I'm performing practical assessment 6.2.1 set up for surgical procedure. So today our surgical procedure is the neutering of a 6-month-old female King Charles Cavalier Spaniel and she weighs 6 kilos. So we're setting up in surgery first. So to start off with, we need to get the right tubes attached. So we've got the small tubes because she does weigh under 10 kilos. I'll just start off with picking the correct kit. So the correct kit for today is the surgical kit, which is marked with SX, meaning surgical kit. That's the right kit for this procedure because it has all the correct equipment, including a spay hook. So I'll grab that one out. With our surgical kit, we do have the surgical tape on it, which does have indicated with the black lines that it has been properly sterilised. Also on this we have the date, the name of the kit and the initials of the vet nurse who sterilised the kit. So I'll set this one up here for the vet. Back over here we do have our bear hugger set up. As she is the smaller animal, we do have our smallest bear hugger set up, and that's used to keep the animal secure and warm throughout the procedure. Also with our tubing on the end we do have hooked up our monitor, which will monitor the animal throughout the procedure, as well as doing heart rate and respiratory rate manually, watching the airbag fill up, and also using a stethoscope to monitor the heart rate. So with our suture material, we do have the internal suture material out for the vet, and we do also have the external suture material in the cupboard if the vet does choose, and we'll grab that one out, and that will be given in a sterile manner to the vet by the nurse. Also, because it is desexing, we do have the tattoo pliers and the tattoo ink to give her tattoo so that she's easily recognised as desexed. So with our kit also, the vet will need today a hat, gloves and mask for the procedure. So out here we do have the hat and the mask, which the vet will apply to themselves before scrubbing in. After scrubbing in, we'll walk back in here, and the vet will be able to put on their gloves once the nurse has sterilely supplied those ones to them. So grabbing the indicated corner of the gloves, we just peel those apart until you can see the corner of the gloves, then shifting your grip across to the middle, just pulling those ones down, making sure not to touch any of the inside of that, and then pulling it down enough so that the vet can grab that one out, only touching the inside, or so that we can put that one on top of the sterile kit once it's open. Also, we do have to prep the outside prep area for when we're prepping the animal for induction. So out here again, we do have to set up the tubes, and because she is under 6 kilos, it will be the small tubes. So setting these ones up, we do need to attach the oxygen and the anaesthetic. So with the oxygen, just attach that one in there. Also, the scavenging does need to be attached as well. So unplugging this one, and attaching that one on here. Making sure that all of the set is closed so that the only oxygen that's coming in and out is going to the animal. Also, the tubes should be tested to make sure there are no leaks for the procedure. So you can do that by holding the end off with the palm of your hand or your thumb and making sure the pop-off valve is closed. Then inflating the bag, making sure that it does stay filled for 5 seconds, squeezing to make sure that there is no air coming out, listening for hissing to make sure there is no leak. And then once you're sure that there is no leak in that one, just releasing that one and opening the pop-off valve again to make sure that that one's open for the procedure. Also, we will need the IV catheter and the endotracheal tubes for the procedure. So for this we'll also need the tie to tie those ones in. With the endotracheal tubes you can choose 2 to 3 to make sure that you do get the right size for the animal. If the first estimated one you picked isn't the right size, you have got a second one to test. So for her, because she is fairly little, we have picked a 7 and a 6.5 for those ones. And obviously the tube to tie that one in. Then we've also got the catheter, and we do have the tape ready and the scissors to make sure that we can secure that catheter in. Also, we do have our clippers. We did have our clippers. Those ones are obviously in use as we are in a busy clinic at the moment, so those ones have obviously been grabbed by someone. But we will use that one to shave the access site for where we will put the catheter in. Also, we do have our Chlorohex to clean the site to make sure that it is clean when we're putting the catheter in. Also, with our endotracheal tubes, those ones do need to be tested for leaks as well. So we've got our syringe used to inflate the cuffs. So we'll just double check those ones. Filling that one up as much as you can to make sure that there is no leak. And then just giving that one a squeeze to make sure that it isn't leaking. And you'll do that with all of the endotracheal tubes that you're using for the animals to make sure that when you go into procedure there isn't a hole in that one, because that does need to be fully blocked off so that only oxygen that is going through and the anaesthetic that is going through the one way and not leaking through around the outside. Also for the procedure we will need eye lube, and that's just to make sure that the eyes are kept lubricated throughout the procedure. And if this was a procedure on a cat, we would also need the spray which we use on their throat, which just helps to relax the muscles so that as it is a number, so that it is better for their throat, as they do have very sensitive throats. Also throughout the procedure it's very important while prepping and also while in the surgery to be monitoring all the vital signs. So out here we do have the pulse oximeter, and then we will also be doing manual monitoring, such as using a thermometer to test the temperature and also using stethoscope for the heart rate, and then just watching the bag as well and monitoring the time to make sure that all the vital signs are good.